Healthcare can feel complicated. We're here to help make it simpler to understand. When you're reviewing health plans, you may wonder about the difference between an HMO and PPO. They're both network-based health plans, and their names sound similar, but they work a little differently. Let's dive into it. HMO is short for Health Maintenance Organization. That name refers to the plan's overall goal, to help maintain your health. PPO stands for Preferred Provider Organization, named after its network of preferred providers who offer care at a lower out-of-pocket cost. But more important than their names are how these plans work. The key differences between HMO and PPO plans come mostly down to two things: cost and flexibility. HMO plans typically offer lower premiums and out-of-pocket costs, but you need to stay within the network to receive coverage. If you get care from an out-of-network provider, you'll pay the full cost of that service. PPO plans tend to offer a larger network of providers, and you can even see providers outside the network. You can save money when you stay in network, but you have the flexibility to go outside the network. The two plans also differ in how you obtain specialty care. With HMO plans, you'll go through your primary care provider for a referral to see specialists. With a PPO, most plans allow you to see a specialist without a referral. So, when you think of HMO plans, think lower costs, but a limited network. When you think of PPO plans, think flexibility and more choice. Choosing between an HMO or a PPO plan comes down to what matters to you. Do you like the freedom to choose your own doctors and specialists? Do you want to make sure you have coverage even if you go outside the network? Then a PPO plan might be right for you. But if you'd like to control your costs with lower premiums, don't travel much, and typically don't see specialists, then an HMO plan might be a good fit. Before you enroll in any health plan, it's a good idea to look at all the plan details. What are your monthly premium costs? Is there a deductible to meet? Are your doctors in network? What are your out-of-pocket costs? How are you covered for emergencies? There's a lot to consider. But knowing how HMO and PPO plans differ might give you a clearer picture when it's time to choose your next health insurance plan.